Hello, I'm Dr. Dennis McKenna. I'm joined today by Dr. Alan Boulos. Alan, great to have you here.
Thank you. Great to be here.
I know you've done other videos with us in the past.
Yeah.
Everybody knows Alan. Albany Medical College class of 95, the 18th Dean of Albany Medical College.
Yes, thanks.
Only the third alum to sit in that very important chair. So great to have you here, and I know we're going to be doing an update, mostly focusing on the college today and its academic and its research mission. And so let's just jump into it. Today is Monday, November 25th, giving you the update from Albany Med. All right, happy Thanksgiving week to you.
Yes,
I know Thanksgiving is a few
well.
days from today. When we have the holiday season, there's often a desire, a need, a willingness to kind of share with the community. We know that our medical workforce here at Albany Med is very generous with its time and its talent in the community. There's an important initiative going on right now being led by the medical students. This is a winter coat drive where under, I think, the leadership of yourself, Teresa Wyman, we're collecting coats that would be distributed to two parties, the Interfaith Partnership for the Homeless and the Capital District Latinos. The coats are being collected between now and December 6th, and I think it's on the B entries where you can drop them off. So we know everybody's got winter coats, right? If you're going through your closet and realize they don't fit anymore, it's a great place to drop them off.
Absolutely.
So I'd start first of all by thanking your medical students for their generous spirit, but talk a little bit about the service learning projects and the fact that our medical students do these things all the time, year round.
Yeah, so it's been a great strength of the school. Really back in the early 90s, we began the service learning initiatives under Dr. Pohl's leadership in the college. And it's only grown. As you know, their first day in orientation, they do spend time on out in the community because it is such an important part of understanding health. Increasingly, we've gotten more and more understanding that what we do in the office and what we do in the hospital is just a very small piece of a patient or a societal member's individual health, and so much more of it is really at home. And so as we get out into the home and as medical students, they can learn more about people's communities. We can be there to help serve them.
Wow. We thank the medical college. We thank the medical students. We remind you, winter coats through December 6th, the B entry. Like I said, if you have some and you're inclined to realize they don't fit anymore, or maybe it's time to move them on, there's a great place you can bring them and they'll be put to good use.
I think I have a few.
Yeah, I do too. I'll be coming in. We talk often about Albany Medical Center being an academic medical center with three parts to our mission: clinical care, education, research. Two of those sit heavily in the college. Of course, we know that research and education also takes place in the hospital as well. But when we think about the college, we often think about research. Let's talk about some important things happening over there. First of all, Dr. Shabazov is an incredible transplant surgeon here. We're very fortunate to have his talents. And most recently was doing really what could only be described as an incredibly cutting-edge type of surgery with a robot.
That's correct. He joined us a couple years ago from SUNY Upstate before that, and he's been a great addition to our transplant surgery program and to our Department of Surgery altogether. He leads the robotic committee, and he's a shepherd of that resource, which is a very important resource. He also has used it, and so the robot, the Da Vinci, allows for a more precise operation, so the recovery for patients tends to be much quicker. And in this case, he used it for the living donors, so people who are willing to donate a kidney to somebody who's on the kidney list, which there's over 90,000 people on that kidney donor recipient list. This provides a more accessible and a less injurious way to do that surgery. And in fact, he came with that skill set and he's built upon it and he's already established it as a very effective mechanism. And you can imagine more patients might be willing to go through that surgery knowing that it's less challenging to recover from it than the older version. I also have to add, we've had a long history of kidney transplantation here. We've been in the top number 1, 2, or 3 in the country for the 3 and 5 year survival rate of those transplanted kidneys. And so it's really a remarkable legacy that he's continuing to shepherd for us.
Well, we stand on the shoulder of giants, right? Before Dr. Shabazov, Dr. Conti, before him, Dr. Lempert, right? And these individuals are pioneers and the only transplant program in the region, and as you said, some of the best outcomes in the entire country. So congratulations. An important grant was received, significant grant, $4 million in fact, from the National Institutes of Health, focused on dementia research. And I know this is another area that you would like to talk about proudly.
Yes, this is congratulations to Dr. Zuluoga and her lab and her team. This is a really important research space because it affects so many adults, cognitive decline and dementia.
Right.
And she's looking very carefully at the sex differences and trying to identify how hormones could affect the acceleration of those disease processes. And it ties in very nicely with some of the other research done in the other basic science labs, and so it provides kind of a construct for which we can be a center looking at aging altogether. And so it's a very exciting award that she's gotten. That and Dr. Alejandro Adams also received an NIH award related to endothelial dysfunction in multi-organ failure, which unfortunately is a very common consequence of being severely ill. And so that's another topic that it affects a fairly significant group of patients and can very much be research that drives better outcomes for the hospital and for the nation.
Well, congratulations to them and their teams. Alan, well, before we talk about the next topic, what is translational research? What does that mean?
Yeah, translational research sits between there's kind of discovery science research, which is looking at fundamental principles and why they happen in our body or in biology or in science in general. And then there's clinical research, which is like a robotic surgery. Does it improve outcomes? Asking a clinical question. Translational is taking the fundamental understanding and seeing if you can develop a new therapeutic tool that can then be used in the clinical space. And so it's an important element that I think we are ripe and do very well here because we have that close geography where we have the basic scientists, the discovery scientists working so closely with the clinical doctors. We can ask those questions and bring that translational research to the fore.
And certainly in these videos in the past, we've talked about the work of Dr. Jadovich as a perfect example of translational research. And I think what you just previously mentioned as well. Last week, there was a forum on this campus, is a translational research forum, where working with our development office and obviously our very skilled PhD scientists, there was a presentation to the community where there were 3 different scientists who spoke about their translational research here. And it was very well done. It was videotaped, and it's something that certainly will make available to our workforce to see. It's something that we should be very proud of. And I know that members of the community who came in, who may possibly be looking to also support us in that important mission through their own generosity of philanthropy, we're very impressed by. So we want to thank the scientists who did that. We want to thank our development office who put it together. And we want to thank the members of our board who attended. And we know several did.
I'll just mention, so Dr. Gabby Fredman really helped shepherd it, and she did a wonderful job presenting the translational work she's done. And Dr. Jadovich, we previously mentioned. Right. The third was interesting. Dr. DiPersio talked about how important the philanthropy was to getting this research done. And so the Brown family had given a very nice gift to his lab, and that allowed him to identify potentially a marker for diabetes mellitus, which is a very common disease. And he very thoughtfully presented that and how that contribution was only made possible through that philanthropy.
Yeah, congratulations.
Yeah, so it was really quite remarkable.
You have over 500 medical students here. Obviously, we have other students at our medical college as well. They all do remarkable things. We'll highlight one right here. This is Bobby Chapman, who's a 4th-year medical student.
That's right.
Who recently was working with a couple people, I believe Dr. Gina Geis. He was also working with members of our development office in the application of and then ultimately the awarding of, and let me read and get this right, the Lorna Breen Award, which is a Well-Being First Champion Award. And this has to do with the fact that as clinical people, you have to get credentialed to work in a hospital. You have to fill out about not only your training and your education, also about your physical and mental health. And sometimes those questionnaires are written in a way that stigmatizes people, when in reality we know that people can have both physical and mental health and still practice at the highest level of their license. And Bobby worked hard to reduce that stigmatization process. And again, credit to the medical college and the medical students for doing that important work.
Yeah, it's a great intersection of the students helping facilitate what everyone wants to see happen, and also a real thank you to the clinical leaders. So Dr. Daniel Pauzet was instrumental in developing that. Dr. Taliski is the one that directed Bobby to the right people to have that happen. So it's a whole group of physicians that interacted with Bobby and others to see this actually happen, and it's just there's a lot of effort that goes whenever there's multiple disciplines involved, and it's just great to see everyone persist and get it through.
And it's a very important area, obviously, and it's the type of work that obviously I would expect the future Dr. Chapman will be heavily involved in.
Right.
I wonder what he's going to be applying for. Do we know what specialty?
I do not know.
Well,
That's a good question.
Someone will be lucky to get him.
Yes.
Speaking of mental health, there's a very important accomplishment that occurred down in the Pediatric Emergency Department, down in the Masry Family Emergency Care Center. As we know, over the last few years, there's been an uptick, an increase in the number of young children, adolescents who have mental health crises, often needing to come into an emergency department to get that care. And ultimately, those individuals, unfortunately, in the past, had to spend some of their time, maybe not in a private room or maybe even in a hallway. That's all changed now. We have the opening of The Cove, a list far too long to list of people to thank, but there's a great article on the internet. I encourage you to look at it that lists those people involved: clinical people, clinical leadership, nursing leadership, facilities, IT. This is really a game changer with 6 private rooms for those individuals who need private space in order to get through their crisis.
Yeah, it's incredibly important. I mean, the reality is we're addressing a need that's been unmet in this region, in this community, and it is a serious effort that had to be undertaken for that to be accomplished. And it's got full, I'm sure, right away. The need is going to be greater than what we can do, but every little bit counts, and this was a great effort to show that we care and we're doing our best to address it.
For sure. We call it The Cove. It's got 6 rooms. They're separate, they're secure, they're safe, they're staffed, and it's the type of thing that only Albany Med can do, and we thank everyone who helped make it happen.
Yeah.
Before we finish up on the Holiday Challenge, anything else you wanted to talk about today?
No, I think those are the big ones.
Well,
Thank you.
Well, we'll end on the Healthy Holiday Challenge, right? We all know Thanksgiving is going to be later this week. Hopefully, maybe you'll run the turkey trot or something, but then we all go home and we eat a lot of pie and stuff. So the time between Thanksgiving and New Year's is often an area where people need to celebrate, enjoy, but maybe focus on health. The Healthy Holiday Challenge is being put on by our Wellness Committee. Again, information on the intranet. Please look into that. The goal is between November 28th and January 2nd, try to keep your weight within 3 pounds, right? So it's not about losing weight, but it's about maintaining and maybe even considering some other healthy things like getting outside, being active. And
So you shouldn't gobble till you wobble?
you shouldn't go. If you do, then you got to make sure you run
the 5K.
You run the 10K turkey
10K for
trot.
that one?
It's really about making healthy choices, right? Which around the holidays, and obviously as an area that focuses on health here on this campus, I think our workforce knows that better than most, but it's a great reminder. And sometimes those things motivate people to maybe, if they're part of something bigger, they join it. It gives them a little bit of accountability.
I'm kidding. It's a great time of the year to get healthy, and also just be careful, the cold.
Right.
So running's important, but warm up, stretch, do all the things you need to do to prevent injury as well.
Thank you. A lot of great things happening on this campus. I think the next time we do an update, we'll talk about what is the significant, remarkable, measurably objective, better improvement in the emergency department. And I know that's an area that we need to spend some time on, so we'll do that as well. And a lot of other great work happening here on the campus. So I'm glad that we could focus on the college today, the important work of our students, our faculty, our PhD scientists, the research, the education piece. It's really one of the things that differentiates us from anywhere else in 25 counties.
Yeah, I appreciate the time. It is such a special place, and they do so many great things. Right. I'm only really touching the stuff that happened in the last few weeks, but it is an amazing group of students and faculty.
Two proud alum.
Yep,
you and
right
I.
here.
Very good.
Yep.
Thank you, Dr. Boulos, for being here, and have a great Thanksgiving to you and your family.
You too.
And also to all of you. We know some of you will, in fact, be working on Thanksgiving or perhaps one of the other holidays later on as we keep the doors open 24/7. And we thank you sincerely for that effort, now more than ever. And we'll be back again to update you again in a few weeks. We ask that you take care of yourself and take care of each other, and have a great holiday.